welcome to Medico Important Simplified. So we are going to cover in community medicine Niddcp, Idsp and Icds. These three are separate questions. So what does Niddcp stands for? Niddcp stands for National Iodine Deficiency Disorder Control Program. Okay, National Iodine Deficiency Disease Control Program. So this is the logo of National Iodine Deficiency Disease Control Program. In 1962, it was started as a National Goiter Control Program. Around 1962, it was started as a National Goiter Control Program. But in 1986, it was renamed as National Iodine Deficiency Disorder Control Program. So this National Iodine Deficiency Disease Control Program was renamed from NGCP to Niddcp around 1986. Now there is we will be briefly discussing about this program in these heading. TSOM. What is TSOM? T for target, S for strategy, O for organization, and M for monitoring. Okay, now first target. Let's in this National Iodine Deficiency Control Program, what is the target of Niddcp? Target is less than 5% prevalence of iodine deficiency disorder in the child. So the prevalence should be less than 5%. Iodine deficiency disorder prevalence must be less than 5%, especially in child around 10 to 14 years. Okay, and iodine deficiency disorder prevalence should be less than 10% in all age group. See, iodine deficiency disorder should be less than 5% if it is a child. The prevalence of iodine deficiency disorder should be less than 5% in a child and less than 10% if in all age group. Okay, in all age group. Now let's move on to the strategy. So what is the strategy? Strategy is basically we are going to do iodization of salt. So what is going to be done? Iodization of salt is going to be done, and the type of salt is going to be a potassium iodate or an iodide salt. So what type of salt it's going to be? Potassium iodide or iodate salt. So what is our strategy? Our strategy is iodization of salt, and the type of salt we are going to use is potassium iodate or iodide salt. Now iodine concentration is very important MCQ. At manufacture level, what must be the iodine saturation according to Niddcp? At manufacture level, it's going to be more than 30 ppm. So iodine concentration at manufacture level must be more than 30 ppm, and at user or a consumer level, it must be more than 15 ppm. Very important MCQ. So according to Niddcp, our strategy is going to be iodization of salt, and the salt uses potassium iodate or a potassium iodide. So they will ask this question that iodine concentration in manufacture level. At manufacture level, so at manufacture level, the iodine must be more than 30 ppm, and at consumer level, that is we eating the salt, must be definitely more than 15 ppm. Okay, now let's move on to the next. TS is finished. O stands for organization. Now organization, first let's look in district level. In district level, the organization is DGC. What does DGC stands for? D for district, G for goiter, C for control cell. It is district goiter control cell. So at the level of district, we are having district goiter control cells. So we have these DGC, district goiter control cells, at the district level. What is the function of DGC? It is to conduct national iodine deficiency disorder survey every year. So iodine deficiency disorder survey must be conducted by DGC cells every year. Now the district will be having 30 clusters that are chosen. So because 30 clusters are chosen, this kind of sampling is known as cluster sampling. So cluster sampling is done in NDD, NIDD, CP. And 90 children in this cluster sampling, 90 children are going to be picked from each cluster. From each, first in a district, 30 clusters will be chosen. From these 30 clusters, in each cluster, 90 children are going to be picked from each cluster. Now, based on their school enrollment rate, now how are these 90 children going to be picked up is based on two criteria. One is the school enrollment rate. Okay, that is the population is proportionate to the size sampling always. So school enrollment rate is a very important criteria for picking up these children. Then the second criteria is gender. Male is equal to female. That is, it is going to be a simple stratified sampling. Now, after picking up just 90 children, we are going to look for three things. First is iodine in the household salt. So how much of iodine is there in the household salt? Second is we are going to look for the goiter rate. Goiter rate by especially palpation method. Goiter rate is be looked by palpation method. And then 50% is going to be in urinary iodine excretion rate. So 50% will be the urinary iodine excretion rate. So again I am revising. So from a district 30 clusters are chosen, and from each cluster 90 children are chosen. That is known as cluster sampling. So how are these 90 children going to be picked is by school enrollment rate. School enrollment rate because the population is going to be directly proportional to the sampling size. And then gender, if mostly male, it will be equal to female, and it's going to be a simple stratified sampling. And then you're going to look for these three things. The iodine content in the household salt. Then second is goiter rate. Okay, by palpation method we are going to look for the goiter rate. And then 50% will be the urinary iodine excretion rate. Now the last TSOM finished. TSOM, we are going to deal with M. M stands for monitoring and evaluation indicators. So what are these monitoring and evaluation indicators? So monitoring and evaluation indicators are, first is goiter rate, then urinary iodine excretion rate, iodine in household salt. First is going to be, okay, let's deal in detail. First is the goiter rate. Goiter rate, we are going to be seeing it because it is a chronic or a long-term impact indicator. It is a chronic for a long duration, okay, long-term impact indicator. It's a chronic or a long-term impact indicator. That is why we are choosing goiter rate. The second is going to be urinary iodine excretion rate. Now why are we seeing urinary iodine excretion rate is, it is a most important indicator, very important MCQ, which is the most important monitoring indicator in Niddcp. It is urinary iodine excretion rate. It is also an epidemiological indicator and also an impact indicator. So remember these three words. Urine iodine excretion rate is the most important indicator. It is also an epidemiological indicator and an impact indicator. Now next, moving on to the third one, iodine in household salt by using MBI kit. So what is this MBI kit? MBI kit is an acronym for iodized salt test kit, and basically the salt is going to be fortified with potassium iodide and it contains iodine. So that is MBI kit. So how are you going to check iodine in household salt? So checking for iodine in household salt is going to be checked by using MBI kit. So it will detect the fortification of salt with the potassium iodide Okay, giving the iodine content. Okay, estimating the iodine content. So iodine in household salt is a process indicator. Important one. It is a process indicator and operational indicator. These two terms are very important. So iodine in household salt is a process indicator and a operational indicator. So moving on to the next one is neonatal hypothyroidism rate. Very important, guys. So neonatal hypothyroidism rate is very important because it is the sensitive indicator for assessment of the NIDD-CP at the community level. This is a frequently asked MCQ, which is the most sensitive indicator for assessment of NIDD-CP at community level. So these two are important. Sensitive indicator, community level. The answer is neonatal hypothyroidism rate. And then the last one is the cretinism rate. So I am revising monitoring and evaluation indicators. We are having 5 rates or 5 indicators. Okay, there are 5 indicators for monitoring and evaluating the iodine level. First one is the goiter rate. Goiter rate is used for a chronic or a long-term indicator. It is a chronic or a long-term impact indicator. The second one is going to be the urinary iodine excretion rate. So the most important indicator is urinary iodine excretion rate. It is also an epidemiological indicator and impact indicator. Then the third one is the MBI kit. MBI kit for iodine in household salt. It is a process indicator as well as an operational indicator. Then the fourth one is neonatal hypothyroidism rate. Neonatal hypothyroidism rate is a sensitive indicator for the assessment of NIDD-CP at community level. Sensitive indicator for assessment of NIDD-CP at community level is neonatal hypothyroidism rate. And then the last fifth one is the cretinism rate. Now let's move on to read the urinary iodine excretion rate. So urinary iodine excretion rate, which is the normal value, more than 100 mcg per liter is the normal value. Remember, urinary iodine excretion rate more than 100 mcg per liter. More than 100 mcg per liter is the normal value. Next is 50 to 100 is a mild public health problem. So if it is more than 100 less, if the excretion of iodine is less than 100, then it's going to be a public health problem, right? So 50 to 100 mcg is a mild public health problem. 20 to 50 mcg is a moderate public health problem. And less than 20 mcg is a severe public health problem. So remember, normal is more than 100 mcg per liter. If it is 50 to 100, it's a mild public health problem. 20 to 50, it's a moderate public health problem. Less than 20, it's a severe public health problem. Now moving on to the goiter rate. So goiter rate, if you look at the goiter rate, more than 5%, if the goiter rate is more than 5%, then it is a public health problem. Okay, it is a public health problem. And if it is 5 to 19%, if goiter rate is like 5 to 19%, then it's going to be a minor public health problem. And if it's 20 to 30%, it's a moderate public health problem. More than 30%, it's a severe public health problem. So always remember, when do you say goiter rate is a public health problem is if the goiter rate is more than 5%. Okay, if it is more than 5%, that is when it's going to be a public health problem. Normally the goiter rate must be less than 5%. So if at all it's 5 to 19, it's minor. If it is 20 to 30, it's moderate, and more than 30, it's going to be very severe public health problem. Currently most parts of the India have goiter rate of less than 5%, and only few have 5 to 19%. Remember, less than 5% is normal. Now let's move on to the next important question. So we finished NIDD-CP. Now moving on to Idsp. So what is this Idsp? Integrated Disease Surveillance Project. Very important question. In short notes it will come. So pay attention. So integrated disease surveillance project. So this is the logo of Idsp. Integrated. See, it's you can see three people are integrated development of and surveillance project. Integrated disease surveillance project. Integrated disease surveillance project was started in which year? 2004. So integrated disease surveillance project was started in which year? 2004. It comprises of three things. SPL. Remember that mnemonic is integrated disease surveillance project is special. So integrated disease surveillance project is special. That is SPL is the mnemonic. S stands for syndromic surveillance. P stands for probable case surveillance. L stands for laboratory surveillance. So S stands for syndromic surveillance. P stands for probable case surveillance. And L stands for laboratory surveillance. So what is Idsp? Integrated Disease Surveillance Project. Which year it was started? 2004. And the mnemonic is SPL. S for syndromic. It's a syndromic surveillance. P for probable case surveillance and L for laboratory surveillance. Now let's look at objectives of each surveillance. So first is the objectives of syndromic surveillance. See, syndromic surveillance is going to be done by the health worker. Okay. And what form? See, each surveillance, the health worker will be using a form to fill up. Okay. That is going to be S form. Syndromic surveillance. So it is going to be done by the health worker and S form is used. So what are the covers of 6 syndromes? Very important. Syndromic surveillance covers totally around 6 syndromes. That's why it's known as syndromic surveillance. So it comprises of 6 syndromes. So what are they? The first one is fever. Fever with or without localized sign. So fever with or without localized sign. It can be due to malaria, measles, malaria, Japanese encephalitis as well as dengue. So fever with or without localized sign, it can be measles or malaria or Japanese encephalitis or dengue. Then the second one is cough. Cough is for what? TB. And then the next one is acute flaccid paralysis. Acute flaccid paralysis due to poliomyelitis. And then the fourth one is jaundice. Jaundice can be seen in either hepatitis, leptospirosis, malaria or yellow fever. So jaundice can be due to either hepatitis, leptospirosis, malaria or yellow fever. And then the fifth one is going to be diarrhea. Diarrhea, very commonly the cholera. Then the sixth syndrome is unusual disease. It's an unusual disease or it is an unusual death. That is due to anthrax or plague. So I am going to be revising the syndromic surveillance. So syndromic surveillance is done by the health worker. It comprises of S form. Why it is known as syndromic surveillance? It comprises of 6 syndromes. It covers 6 syndromes. The first one is fever with or without any sign. It can be due to malaria, measles, Japanese encephalitis or dengue. Then the second one is cough, to rule out TB, cough, TB. And then next one is acute flaccid paralysis for poliomyelitis. And then the fourth syndrome is jaundice. Jaundice can be seen in either hepatitis or leptospirosis or malaria or yellow fever. Hepatitis, leptospirosis, malaria, yellow fever. And then the next one is diarrhea due to cholera. And the sixth one is an unusual disease or unusual death resulting from anthrax or plague. These are the 6 syndromes. Next, moving on to the laboratory surveillance. Okay. So laboratory surveillance is going to be by whom? Definitely the laboratory technician. Obviously. So laboratory surveillance will be by the lab technician as well as the laboratory people. And the form used is going to be a L form. Okay. So laboratory surveillance is by laboratory technician and laboratory people, and the form used is L form, and the diseases that are covered. So what are all the diseases covered under L form, okay, or the laboratory surveillance? It's going to be dengue dengue hemorrhagic fever or dengue shock syndrome. It can be any of these. Then it can be Japanese encephalitis or typhoid fever, cholera, viral hepatitis A, leptospirosis, Plasmodium vivax, chikungunya, meningococcal meningitis, diphtheria, Shigella dysentery, viral hepatitis E, malaria, and Plasmodium falciparum. So, what are all the diseases that are covered? So, diseases are dengue, Japanese encephalitis, typhoid fever, cholera, viral hepatitis A, leptospirosis, Plasmodium vivax, chikungunya, meningococcal meningitis, diphtheria, Shigella dysentery, viral hepatitis E, malaria, and Plasmodium falciparum. So many diseases are covered under laboratory surveillance. Now next, moving on to probable case surveillance. So what is probable case surveillance? Probable case surveillance, here the P form is going to be used, and it's going to be done by a medical officer. So there it was done by a healthcare worker. The first one, sentinel surveillance, and the laboratory surveillance was done by laboratory technician and laboratory people, whereas the probable case surveillance is going to be done by a medical officer. And there are certain diseases that are covered under probable case surveillance. First one is going to be acute diarrheal disease, then enteric fever, and then dengue or dengue hemorrhagic fever or dengue shock syndrome, and then chikungunya, then meningitis, diphtheria, chickenpox, acute respiratory infection or influenza-like illness, ILI, influenza-like illness, dog bite. Any other state-specific disease, leptospirosis, viral hepatitis, malaria, acute encephalitis syndrome, measles, pertussis, fever of unknown origin, okay, pyrexia of unknown origin, pneumonia, acute flaccid paralysis less than 15 years of age, snake bite, unusual syndrome not captured above, specify clinical diagnosis. So unusual syndrome not captured above, that is, you need to specify clinical diagnosis. So probable case surveillance, P form is used, it's by a medical officer, and there are so many diseases covered. Remember acute diarrhea, enteric fever, dengue, chikungunya, meningitis, diphtheria, chickenpox, ARI or ILI, dog bite, leptospirosis, viral hepatitis, malaria, measles, pertussis, pyrexia of unknown origin, pneumonia, acute flaccid paralysis, snake bite. Now, see, under surveillance, what you need to do is all the data are going to be collected every 14 days or 2 weeks and published on a monthly basis. So, in this surveillance, what they will do is they will be collecting all the data, okay, every 14 days, and then they will be publishing monthly on monthly basis. Now what is CBHI? Central Bureau of Health Investigation. CBHI, that is Central Bureau of Health Investigation, is the next version of Integrated Disease Surveillance Project. So Integrated Disease Surveillance Project, the next version is Central Bureau of Health Investigation. What is IHIP? Integrated Health Information Program. It is the digitalization of health records. Nowadays health records all are going to be digitalized. That is via this Integrated Health Information Program. So we finished this question. Integrated Disease Surveillance Project is finished. Now let's move on to the next question. Integrated Child Development Services, very important. So this question is very important, frequently asked question. Yeah, integrated child development services. So integrated child development services, this is the logo of ICDS. Okay, integrated child development services. Now on 2nd October 1975, ICDS was launched. Very important. So when was ICDS launched? ICDS, Integrated Child Development Services, was launched on 2nd October 1975. 2nd of October on Gandhi Jayanti. Remember, ICDS was started on Gandhi Jayanti. Integrated Child Development Services was started on Gandhi Jayanti, that is 2nd October 1975. Under the ministry of whom? Under the ministry of, I forgot to tell you one thing, guys. In NIDDCCP, NIDDCCP is basically under the Ministry of Health, Ministry of okay, leave it. Okay, ICDS was under the Ministry of Child and Child Development. Ministry of Child and Child Development. So there are certain objectives of ICDS. First objective is a holistic development of the child. Holistic development of the child, it includes all the three components, that is the social component, the physical component and the nutritional component. First objective is holistic development of the child, social component, physical component and nutritional component. And then the next primary objective is safe motherhood. Safe motherhood. First is holistic development of the child and the next is safe motherhood. Now what are the beneficiaries? Objectives are done. Now next, moving on to the beneficiaries. So beneficiaries of ICDS, first children, mother and adolescents. Children age 0 to 6 years of the age are benefited by this program. So ICDS 0 to 6 years of children, mother both pregnant as well as lactating mother, and adolescent girls, that is less than 19 years of age. Children 0 to 6 years, mother pregnant and lactating mother, adolescent girls less than 19 years of age, all are benefited. Now what are these are the beneficiaries. Then now what are the benefits? First benefit is going to be supplementary nutrition. Supplementary nutrition. So let's look at each one of them: calories, protein and INR. So in a child, additional in a child 500 calories is provided. For mother, additional of 600 calories provided, and for a malnourished child an addition of 800 calories is provided. Protein for a child, it is around 12 to 15 gram. For mother an addition of 15 to 20 gram, and for malnourished child 20 to 25 gram. Next is non-formal education. Next benefit is non-formal education. Under non-formal education, the basic lifestyle, the manners, the hygiene, all of these is going to be covered under non-formal education. So the basic lifestyle, manners and hygiene. And the third benefit is facilitating immunization. Very important benefit, facilitating immunization. Fourth one is promote family planning services as well as basic health care. So to promote family planning services and basic health care. So let's look at the benefits again. The supplementary nutrition, non-formal education, and then facilitating immunization and promoting family planning services and basic health care. So supplementary nutrition 500 in child, 600 mother and 800 malnourished. Non-formal education comprises of basic lifestyles, manners and hygiene, facilitating immunization and to promote family planning services and basic health care. Now moving on to the adolescent health. So adolescent health is another important adolescent health is another important component that is going to be covered under integrated child development services. So what is going to be done in adolescent health? First is there is an adolescent girl health scheme, AG scheme, adolescent girl health scheme. It was lately changed to Kishori Shakti Yojana. So for adolescent health under ICDS we have Kishori. Kishori means adolescent. Shakti means power, and Yojana. Okay. So basically for adolescent health we are going to be providing various things. So that is Kishori Shakti Yojana is an adolescent girl health scheme. So the strategy says G2G approach workshop. What is this G2G approach workshop? Girl to girl approach workshop. Basically a lady will be giving counseling regarding the periods, the menses, about menstruation, all of this to a girl. So that is why a girl is giving is talking about or doing a work, conducting a workshop to a girl. That is girl to girl. So girl to girl approach workshops are going to be done. Okay. Next is Balika Mandal. What is Balika Mandal? It is to empower the uneducated girls. So empowering the uneducated girls is coming under Balika Mandal. Now what is Sabla scheme? Sabla scheme is a state-wise enabled program. Sabla scheme is a state-wise enabled program. It is for overall adolescent girl development. Sabla scheme is for overall adolescent development, girl development, and it includes the following programs. Sabla includes the following programs like the National Skill Development Program, Adolescent Reproductive Sexual Health, Adolescent Friendly Health Clinic, Public Distribution System, Wheat-Based Nutrition Program, Anemia Mukt Bharat Scheme. All of this is going to be coming under the Sabla. So remember, for adolescent health, it is known as Kishori Shakti Yojana, and there is G2G approach, girl to girl approach, Balika Mandal to empower the uneducated girls, Sabla scheme, which is a state-wise enabled program consisting of various things: the skill development, reproductive sexual health, adolescent friendly health clinic, and Anemia Mukt Bharat scheme. Now ICDS training, Integrated Child Development Services training, is known as Odisha. And then the next component in ICDS is growth monitoring via the ICDS growth chart. Very important. ICDS training is Odisha, and in ICDS we also have growth monitoring by the ICDS growth chart. Okay, now weighing. In ICDS, the weighing is going to be done by Salter scale. So the accuracy of the Salter scale is 100 grams. These are all MCQs. So weighing is going to be done by, this is your Salter scale, and the accuracy of this scale is going to be 100 grams. So this is your growth chart. If you look, this is your ICDS growth chart. This is the median value. This is -2 standard deviation, -3 standard deviation. Weight for age chart in boys. The curve always must be uprising curve. Okay, then only then the growth and development of the child is proper. Now let's look at some newer strategies like Sneha Shivir, Anganwadi Karyakarti. Okay, these are not important as such. Yeah, so we have covered 3 questions. Niddcp is covered, and after that integrated disease surveillance project is covered, where there are 4 kind of surveillance. Three surveillance: syndromic surveillance, probable case surveillance, laboratory surveillance. After that, ICDS is covered, Integrated Child Development Services. We saw the date, we saw under which ministry, objectives, beneficiaries, benefits, and ICDS training, growth monitoring. All of this is going to be is covered here. So yeah, this is all about these 3 questions. We're covering the further questions and other topics in common and other subjects as well. So please stay tuned and subscribe, and do like and share this channel if it was useful. Thank you.